Great session that Charlie put together for the presidential session. The Cancer Registry is the data component of that session. It's a really important opportunity, and my role here was to try to provide that opportunity and provide the details of that opportunity to the audience. So the Cancer Registry is a huge organisation now with a massive data set, but at the moment some of the data is not as high quality as it could be, and I was here really to encourage people to engage with the data, but also to think about using the data within the registry. The Cancer Registry is really not what it was 5 or 10 years ago. It used to be the sort of Cinderella data set, which was always thought to be very poor quality and therefore not particularly usable. Now we have 32,000 cases of haematological malignancy registered every year in the Cancer Registry, including nearly 5,000 diffuse large B-cell lymphomas, which is our most common tumour. But for the rare cancers, the rare haematological malignancies, we have quite large numbers as well. So acute myeloid leukemia would be considered to be a rare tumour. We have 2,500 cases registered every year. So the case ascertainment, which is actually capturing all of the cases in England, is good. We are pretty confident now we're capturing all of the cases. What is not so good as yet is to capture the detail of the subgroups of these particular haematological malignancies, and that's where we need to really focus our efforts. That's why I'm here. I'm here to encourage the haematology community to engage with us to try and improve the quality of the data that will allow us to get subgroup analysis. But the very interesting thing about the Cancer Registry is now its linkage with other data sets, NHS data sets. We have a unique opportunity. This is a population-based registry from the NHS in England, which is unique. It has no rival globally, complete coverage of the whole population, linked to other routine data sets that are used by the NHS. For example, hospital episode statistics. Every event that happens within the secondary sector in the hospitals is coded, and so we can say for any one particular cancer patient, we can link to all the other events that are happening in their journey, so we can assess what other comorbidities they might have. We have a chemotherapy data set in England now where every single chemotherapy episode for every patient with cancer is logged. We know that we can link the tumour type to the chemotherapy data set, and the same applies to a radiotherapy data set. And we're also looking now at the prescriptions database for the GPs, which has about 300 million prescriptions in a 4-month period that we're looking at the moment. So trying to link the Cancer Registry to GP prescriptions is another way of picking up on comorbidity, which is a very strong determinant of outcome in cancer. So it's all coming together as a massive data resource, and one that anybody can apply for access to via a standardised procedure through Public Health England. And so we would encourage people to look at ideas that they have for analysing this data repository and come to us with proposals for looking at outcomes and looking at different aspects of haematological malignancy from a population perspective. The CMML community needs a set of guidelines. It's a rare disease, very rare haematological malignancy, that has traditionally, in terms of guidelines, been subsumed into MDS guidelines, and so we really haven't had a defined guideline for this disease. It's quite difficult because there's not a huge amount of evidence for treating this disease with different modalities, but nevertheless it's important to try and actually generate guidelines for these specific rare entities. So a group of us have established ourselves as an international consortium, predominantly European, but with a couple of American colleagues as well. And we're in the process of developing the guidelines, which are at an advanced draft stage, and they embody the whole of the journey of a CMML patient, from diagnosis, from prognostic scoring systems, through to different management algorithms. So we hope that they'll be finished by the end of the year, but tomorrow I'll be presenting some of the highlights of that document as it stands at the moment via some case presentations, which I hope the audience will find interesting. They are European guidelines under the auspices of the European Haematology Association and the European Leukemia Net, but they have US input and therefore they will have an international flavour. They're not specifically for the UK. In the UK we are actually developing a revision of the MDS guidelines, which will happen through this year. That will encompass some CMML component, but will not be a dedicated CMML guideline like we're doing for the European initiative. So slightly different approach in the UK, but compatible.